August, a group of doctors, nurses, physical therapists, and other health professionals from Pittsburgh, Pennsylvania, traveled to Antigua, Guatemala to perform hip and knee replacement surgery on people who would otherwise never have this opportunity. This team of medical professionals, led by Dr. Tony DeGioia, was part of Operation Walk, whose mission is to improve the lives of people with arthritic joint disease in developing countries. Guatemala is a country of over 13 million people, with 60% of the population living in poverty and 32% of the population living on less than $2 a day. If not for Operation Walk and the many generous people who support Operation Walk, the patients in Guatemala would never have these joint replacement operations or be granted the wish to walk. Our headquarters in Antigua, Hermano Pedro Hospital, used to be a convent that was converted into a hospital when the original hospital in town was destroyed by an earthquake. The hospital's mission allows for groups like Operation Walk to perform surgery on people from the villages and surrounding countryside of Guatemala. The first day begins with one team unpacking and stocking supplies in the operating rooms and nursing wards, while a second team begins the evaluation process by examining prospective patients who have been waiting to be seen. As the screening team entered the clinic, the patients and their families stood and clapped loudly while calling out blessings. It was an emotional moment for the team and the first indication of the impact they would make in Guatemala.
I think the things I'll remember the most from this trip is first when our team walked in through the hallways to our very first clinic to see all the patients that we'd be operating on, and the clinic was wall-to-wall people everywhere. A little bit intimidating, but as we walked through the crowd, and there was approximately 30 of us, they started to clap, and it was just amazing. It sets the stage for the rest of the trip.
Each patient is seen by one of the physicians and physical exams are done to ensure the patients are medically stable for surgery. The patient is then seen by an orthopedic surgeon to determine the severity of the arthritis and the amount of disability present. After all the patients have been screened, the entire Operation Walk team comes together to determine which patients will be selected for surgery. Each patient is ranked according to need and general health. Unfortunately, not all patients seen can be selected for surgery, as the number of patients is too large or other health issues pose too great a risk. Once the surgical patients have been chosen, the names of the patients are called. This brings many tears. Tears of happiness for those that have been selected for surgery, and tears of disappointment for those not able to have surgery at this time. For the Operation Walk team members, this is one of the hardest moments of the trip. Guatemalans are hardworking people who rely on their mobility to carry on a normal life and be productive members of their society. Many are farmers and laborers who need to be physically active in order to make a living in this country. Most of us take for granted the ability to walk and perform regular activities like shopping, cleaning, and going to work. But when a debilitating disease like arthritis sets in, even doing the simplest of tasks becomes nearly impossible unless the arthritic pain can be eliminated. Operation Walk Pittsburgh's mission is to improve the lives of people experiencing arthritic joint disease, not only with surgical intervention, but also through education following surgery. In addition to performing surgeries, the Operation Walk surgeons teach the host surgeons how to perform the joint replacement procedures. The nurses are taught how to take care of the patients post-operatively, while the hospital therapists are shown how to rehabilitate the patients using the newest techniques. The team also educates the patients' families on what will be required to best care for their loved ones once they arrive back home to ensure their recovery is as safe and easy as possible.
This was a small hospital. We were able to bring a level of technology with us that allowed us to do the surgery we did. But Other than that technology, this hospital is capable of taking care of everything we did. We brought our team. When our team leaves, people who work here and live here will take care of these people and finish off the rehabilitation and make them get better and go back to their lives. So although they let us come into their community and help them, they are really going to be the ones that drive the process out in the future and take care of these people forever. So to me, this was a very rewarding experience. I was not prepared for the amount of love that we felt from people we really didn't know, nor could we absolutely communicate with clearly.
The operating rooms are bustling with activity as the OR team works tirelessly in order to prepare for and complete all of the scheduled surgeries ahead. Patients are brought into the pre-op area where vital signs are monitored, medications are given, and final preparations for surgery are completed. Amazingly, and true to their character, many of the patients insist on walking into the operating room under their own power. Once the patients are in the operating room, a spinal anesthetic is given to numb the surgical area and make the patient as comfortable as possible. Operation Walk runs 5 operating rooms non-stop, 10 hours a day, for 3 straight days, only resting for as long as it takes to clean and restock the operating room before another patient is brought in for the next surgery. For 3 days, the surgeons and OR staff work continuously to maximize the limited time they have to complete their mission. Another part of the OR team that plays a vital role in the rapid turnover of the operating rooms are the people behind the scenes that are washing, sorting, sterilizing, and wrapping instruments as each surgery ends so that those instruments are ready to go again before the next case begins. In addition to the implants and instruments, each surgery also requires other supplies, such as medications, sutures, bandages, gloves, and gowns, just to name a few. Operation Walk brings and uses all its own supplies that have been generously donated by companies and individuals back home. No implants, no instruments, no medical supplies of any kind are used from the host country. Collecting and organizing these supplies is an enormous task. Once the patients are out of surgery and have been stabilized in the post-op recovery area, they are transferred to the nursing ward where the staff will care for them until they are discharged home. The nursing staff focuses on keeping the patients comfortable, monitoring vital signs, changing dressings, giving medications, and anything else the patient may need. Once the patients get settled in, it is time to take their first walk with their new joint. The physical therapists work to get the patients up and walking as soon as possible, and even though some are just hours removed from having their new joint put in, they are all very eager to walk again.
Also, I'm very grateful that I came because it was a life-changing experience to me to see those people who are in such a great need for surgery and such a great need to come back to normal life. And it was just amazing to see how resilient those people, how they can tolerate the pain, how grateful they are for operation we did for them. So it is unbelievable, life-changing experience. Will bring us back many more times.
Operation Walk's mission is a monumental undertaking, performed by volunteers who leave their families behind for a week, without pay, in a country that is completely foreign to them, and where communication is often an obstacle. But if you were to ask any of the volunteers if the trip is a hardship, they would each tell you the same thing. It's worth every minute away from home. It's all worth the effort when you meet a young man like Julio, whose 10-year battle with leukemia caused his joints to deteriorate. Finally, to get a new knee so he can live a normal life and play soccer with his friends again. It's worth the effort when seeing a woman like Catalina express the gratitude she has in her heart after receiving a new hip.
De la rodilla izquierda y me siento muy bien gracias a ustedes. Son muy buenos doctores.
And it's all worth the effort when a woman like Maria unexpectedly breaks into song and tears over the joy she has because she can walk again. The rewarding week wraps up with the gathering of all patients and staff to take a group photo and celebrate all that has been accomplished. Many tears are shed and goodbyes exchanged as the strong bonds created throughout the week are realized. All of us with Operation Walk Pittsburgh would like to thank all of those who have made Granting the Wish to Walk possible.